Minimally invasive surgery is used in trauma patients in various types of ways. Specifically, over the last, I'd say, 6 to 7 years, it's been utilized and reported more in the literature, mainly for knife stab wounds or gunshot wounds, but also for blunt trauma like motor vehicle crashes or even motorcycle crashes, where you're unsure of the pattern of injuries, and rather than making a very large incision, you can make a couple of small incisions, one as to diagnose or find out specifically what is wrong in terms of what injuries the patient has sustained, and more times than not, we can fix those injuries in a minimally invasive fashion with just a couple of small incisions rather than a very large incision. And there's quite a huge difference in terms of hospital stay and pain control and what we like to call morbidity, which is complications that can arise from surgery itself and long-term complications as well. So minimally invasive surgery is better for the patient for so many reasons. With the amount of technology that we have nowadays, minimally invasive surgery can be used a lot more proficiently for trauma patients, and frankly, it's much better overall.